name's Alyssa Dickerson, and I am doing a research proposal on aromatherapy for nurses with anxiety. Workplace stress is a common issue in the nursing profession. Many nurses live and deal with anxiety daily. Stress in the nursing field may cause exhaustion, burnout, and other physical illnesses. According to the American Institute of Stress, stress is a significant factor in up to 80% of all work-related injuries and 40% of workplace turnovers. Many studies show that occupational stress may lead to decreased quality of patient care. Aromatherapy is one intervention that few healthcare workers are uneducated about. This type of therapy uses essential oils that can be inhaled or absorbed in the skin. In my workplace, aromatherapy is used for post-op nausea and vomiting, but many other staff members don't know that you can use it for stress or anxiety. So Johnson conducted a study in Level 1 Trauma Community Hospital, and they measured pre and post administration of aromatherapy on nursing staff. The result showed a reduced incident of workplace stress and increased energy levels among nurses in hospital settings. It is essential to educate all nurses about the benefits that aromatherapy can have on workplace stress. So my problem statement, work-related anxiety in nurses, demanding nature of occupation. The occupation puts nurses at higher risk. Many healthcare professionals suffer from occupational stress and anxiety. The nursing profession can be physically and mentally challenging at times. The demanding nature of the occupation puts them at higher risk for developing mental states, negative mental states such as depression, anxiety, and stress. Occupational stress is a situation where job-related factors may change nurses' psychological and physiological condition. Stress and anxiety can be a result of being overworked, or heavy patient assignments can also cause that. Occupational stress and anxiety may lead to a variety of problems. Anxiety may affect performance, professional relationships, health, and also their home life. It can also lead to significant health issues. Also burnout, which is a very common thing in the nursing profession. 98% of nurses, according to Bellinger, reported that his or her job is mentally and physically demanding. 85% expressed feelings of extreme fatigue, and 63% expressed feelings of burnout. 44% of nurses said that there was a concern of quality of patient care. 41% considered changing jobs due to high levels of job-related stress. According to the American Institute of Stress, stress is a significant factor in up to 80% of all work-related injuries and 40% of turnovers. So I had to do a literature review, and these are each some resources that I have found. The first one, which is the effects of aromatherapy on aromatherapy massage on sleep quality of nurses on monthly rotating shifts, night shifts, and it was by Chang, Lin, and Chang in 2017. They performed a quantitative research study, to evaluate the effects of aromatherapy massage on sleep quality of nurses on monthly rotating shifts. A simple random sample was used with 50 nurses in a medical center in central Taiwan. The population was split up into two groups, a controlled group and then a treatment group. The treatment group has 27 nurses, and the control group had 23 nurses. The treatment the treatment group of 27 nurses were given the aromatherapy massage, and then the other ones, the control group, were not. They used the Pittsburgh Sleep Quality Index surveys and take-home sleep detectors. The p-value was set at greater than 0.05. The treatment group had significant decrease in PSQI, which is the Pittsburgh Sleep Quality Index, as compared to before. There was also a decrease in subjective sleep quality, sleep disturbance, and daytime dysfunction, which are all the values there. The control group did not have a notable difference in total PSQI, but a significant decrease in daytime dysfunction. The next one is the effect of aromatherapy on anxiety experienced by hospital nurses by Donaldson in 2017. It was a quantitative research study in a level 2 trauma center in Southern California. They did a convenient sample of 44 nurses. Anxiety was measured using the state trait anxiety inventory scoring system. They used diffused aromatherapy. The range of scores similar for pre-test anxiety 20 to 61 and post-test anxiety 20 to 59. They actually had a lack of significant findings for this one, so I didn't find too much for this one. The next one by Aaron and Ostick, however you pronounce it, in 2017, the effects of aromatherapy on stress and anxiety levels of nurses working in intensive care units. They used a quantitative research study to evaluate the effects of aromatherapy on stress and anxiety. A quasi-experimental study conducted at 2 intensive care units. It consisted of 45 nurses working on an ICU. The experimental group inhaled essential oils for 10 to 15 minutes, and the control group did not receive any. These nurses were evaluated using questionnaires, the perceived stress scale, and the state trait anxiety inventory, the visual analog scale, and also blood pressure measurement before and after. There was a significant decrease in nurses' anxiety scores before and after application, and in the experimental group, that is. And it says P was less than 0.001 after. So that was a significant decrease. The next one by Johnson et al. In 2017, they did a study to find the use of aromatherapy to promote a therapeutic nurse environment. They performed a quantitative study to assess stress levels before and after exposure to essential oil lavenders in nurses and other staff members in the nursing field. This included 110 staff members, so these were aides, anybody that worked on the unit in the nursing profession, including registered nurses, charge nurses, patient care techs, and it also took place in a trauma intensive care unit in a level 1 trauma community hospital in Phoenix, Arizona. Staff members were divided into 2 groups, treatment group of 53 and control group of 57. They used surveys pre and post procedure and also t-tests. The pre-survey mean showed 2.97, which was significantly higher than post-survey at 2.7. Let's see, it suggested a difference in how often felt stressed at work in a typical week, trending down from feeling stressed half of the time to once in a while. Study results show that nurses exposed to lavender oil or aromatherapy will have a significantly decreased level of stress and anxiety in one average week. The next one by Chen and Feng in 2015, the effects of aromatherapy in relieving symptoms related to job stress among nurses. They stated that work-related stress has become the most significant occupational hazard today. A study was conducted by them to explore the validity of complementary therapy using lavender oil. They're in two groups. Experimental group of 53 using bottles of lavender oil that were pinned to their shirts, which I have seen this in other hospitals used. And then a control group of 57 nurses with empty bottles pinned to their shirts. Symptoms of stress decreased from 6.1 to 2.8 in the experimental group, and the control group resulted in an increase in symptoms of anxiety from 5.6 to 5.8. So my PICO question, the targeted population would be nurses experiencing work-related stress. The primary intervention is the utilization of aromatherapy and essential oils. Use of aromatherapy compared to not using aromatherapy, and the desired outcome is to reduce the incidence of stress in nurses. So the theoretical framework I looked at Betty Newman's systems model. It focuses on the patient's response to environmental stressors. The theory includes primary, secondary, and tertiary nursing interventions for retention, attainment, and maintenance of a person's well-being. The primary prevention involves the identification and reduction of risk factors in patient assessment and intervention phase. The secondary prevention correlates with the clinical presentation following reaction to stressors and the appropriate ranking of intervention priorities and treatment. Tertiary prevention involves the patient's ability to adjust and maintain in order to cycle back towards primary prevention. The nursing theory applies to the proposal because the research utilizes interventions mentioned in this model to decrease work-related stress in nurses. The primary prevention is to identify nurses at risk or presently experiencing mental or physical burnout. Secondary prevention is to administer aromatherapy to those nurses in need of intervention or treatment. Last, the tertiary prevention is to provide support and education to nursing staff to prevent and reduce stress and insomnia. So my design, sample and setting. The design, I would propose this research study, conducting it using a quantitative design. I would use numerical data obtained from surveys. Pre-post surveys would be used to compare the outcome of administration of aromatherapy versus the issue of no given. The research proposal setting would take place at a rural southern Indiana hospital. Nurses from all inpatient units in the hospital will be included. The research study would use a random sample. Any nurse currently experiencing work-related fatigue or stress would be considered. The nurses must have 2 years of experience. Nurses currently pregnant or physically ill will be excluded. The sample size would be 60 nurses. The time frame of research would approximately be 3 months during the fall and winter because of high census and increased patient illnesses due to the flu season. there would be a control group and an experimental group for the research. 30 nurses in the experimental group will be placed in a room and receive diffused aromatherapy. 30 nurses from the control will be placed in a room without aromatherapy. All of the participants would have the rights and confidentiality protected by using random number assignments and not using names or identifiers. Information or individual results will be shared with others, or will not be shared with others, excuse me. Information or informed written consent will be obtained before they can proceed. So data collection and analysis, it would be collected by quantitative objective measurement. The control group and the experimental group would receive a survey before the study. The survey would give researchers a baseline. The objective measurement would include obtaining vital signs before, during, and after. Measuring blood pressure and pulse levels can help determine whether the patient is experiencing stress. A decrease in blood pressure and pulse may indicate relaxation and reduction of stress levels. After the experiment, the participants would receive a study or a survey to determine whether the aromatherapy may make any difference or not. For the data analysis, I would use paired t-tests and the SPSS statistical software. The data analysis would determine if the aromatherapy would be beneficial in the nurses who struggle with work-related stress and anxiety. Conclusion: work-related stress among nurses is a significant issue in the healthcare field. Stress and anxiety can affect a nurse's performance and mental state. It is essential to educate all the nurses on ways to relieve stress. Aromatherapy can be beneficial in reduction of stress. Researching the effects of aromatherapy on nursing staff could help decrease turnover and prevent burnout. And then there is all my references.